Depression and anxiety are serious, and in severe cases, can lead to suicide. On April 25, 2020, a Bronx CMT shot himself. 2 days later, a Manhattan ER doctor committed suicide. Many healthcare providers don't feel like heroes. In fact, they feel defeated by the COVID-19 virus. The virus that has shut down the whole entire world. But what can trigger, cause, or even worsen depression and anxiety? Stress. Stress in general, not just the pandemic stress, can lead to worsening anxiety and depression and even chronic health conditions, which then in some cases can lead to harmful habits such as excessive drinking or even drug abuse. But why did the sale of alcohol go up during this pandemic? For example, sales of alcohol have reported an increase during the COVID-19 pandemic. But why is that? Anxiety, depression, and fear of unknowns are some of the factors that are driving people to consume more alcohol to cope with the COVID-19 pandemic. But we have to remember that the increase in drinking will have both short and long-term impact on health and safety. Consuming excessive amount of alcohol can lead to worsening depression and anxiety, and in some cases even nerve damage and worsening of chronic conditions or even the beginning of chronic conditions. Part of this is due to the fact that alcohol abuse can block the absorption and usage of certain very important vitamins such as B1, B12, B6, and even folic acid. But how are these vitamins connected to depression and anxiety? They are needed for the production of many important things in our bodies, such as nerves and a neurotransmitter called serotonin. But what is serotonin? Serotonin is a chemical that has a wide variety of function in our body. It's even sometimes called the happy chemical because it contributes to well-being and happiness. What can a low level of serotonin lead to? Some of the things low level of serotonin can lead to are panic attacks, anxiety, depression, insomnia, low self-esteem, bad thoughts, along with many other things. But how can we increase the serotonin level in our brain in order to decrease symptoms of depression and anxiety or even prevent them? Check with your healthcare provider. Make sure that you're not deficient in any of the vitamins required to make the neurotransmitter serotonin, such as B1, B12, B6, folic acid, and even vitamin C. Consuming enough vitamin C, not only is it important for the immune system, it's also important for serotonin production, the happy neurotransmitter. In addition, since many of us are not out in the sun, it is very, very important to take vitamin D. Vitamin D deficiency is actually linked to depression or worsening depression. In some cases, you might require medications. Talk to your healthcare provider about that. So what are the symptoms of anxiety and depression? Some of the symptoms of anxiety and depression include the following: feeling worthless, withdrawal from family and friends, difficulty sleeping, reckless behavior such as injecting or ingesting disinfectants, sadness, fear from the unknown, trouble concentrating. When symptoms are severe, they can lead to suicidal thoughts and ideation. But how about the ones who have been ingesting or even injecting disinfectants to kill COVID-19? They are a prime example of how stress and anxiety can ruin your life. People who suffer from anxiety and depression are the ones who are at higher risk of poisoning themselves by, for example, ingesting disinfectants, hoping that it's going to cure COVID-19. Could injecting or drinking disinfectants such as Lysol cure COVID-19? Bleach is recommended on surfaces to kill the virus, according to CDC, not for ingesting or personal consuming. Even Lysol makers have issued a warning against ingesting or even injecting Lysol. Please guys, do not inject or drink any disinfectant in an attempt to kill any virus. Are there people out there trying to take advantage of the pandemic to make money and to try to take advantage of people's anxiety and depression and stress? Yes. There are plenty out there. They're actually doing so by selling products claiming a cure COVID-19. Be careful out there. Patients with anxiety can actually experience symptoms similar to what patients of COVID-19 experience: chest tightness, muscle tension, rapid breathing, and those are actually the symptoms of panic attacks. Tragically, let's all not forget about the teacher who has recently died of COVID-19, but her symptoms were dismissed as a panic attack. So what can be done? It's very important to seek support from family, friends, and even health professionals. Here are a few things that you can do to decrease the level of anxiety and fear that many of us are experiencing from the unknown. Number one, take it one day at a time, and remember that this pandemic is going to end and it's not permanent. Number two, limit alcohol and caffeine consumption, which in some cases can trigger panic attacks and aggravate anxiety. Number three, try your very best to get enough sleep. Number four, exercise daily if you can. Exercising can actually release stress hormones and help you get rid of toxins in your body. You can also count to 10 slowly and take deep breaths. Don't allow stress to ruin your life. Take control over your emotions and be in charge of your life. If you like this video, please don't forget to like it, subscribe to my channel, write your comments below and ask your questions. And don't forget that this pandemic is not permanent and is going to end.